Have you ever sat in your doctor's office, watched that blood pressure cuff tighten around your arm, and held your breath as the numbers flashed on the screen? For years, we've been told that 120/80 is the gold standard, the holy grail of health. But then you hit 60, 70, or 80, and suddenly the rules seem to change. One doctor tells you 140 is fine for your age, while another is reaching for the prescription pad if you rate even a point over 130. It is confusing, it is frustrating, and frankly, it is a little scary when it is your heart and your brain on the line. Today, we are cutting through the noise. We are looking at the absolute latest 2026 medical guidelines and landmark studies to answer the one question every senior needs to know: what is the actual, honest to goodness best blood pressure for older adults? The truth might surprise you, and it is definitely not what it was 5 years ago. Before we dive into the data, if you find this video helpful, please hit that like button and subscribe to the channel. We're dedicated to bringing you the most up-to-date, research-backed health information so you can stay independent and vibrant for years to come. Sharing this video with a friend could literally save a life, so let us get this information out there. For decades, there was a school of thought in medicine called the Jacob theory. The idea was that as we age, our arteries naturally stiffen, so we actually need a little more pressure to push blood up to the brain and out to our extremities. Because of that, many physicians were perfectly happy seeing a senior with a systolic that as the top number of 140 or even 150th. They figured, hey, they raised 75 years old. Let us not over-medicate them and cause them to dizzy out and fall. It made sense at the time. But as we've moved into 25 and 2026, the medical community has undergone a massive shift. The truth we thought we knew has been turned on its head by some of the most intensive clinical trials ever conducted on the 65-plus population. First, let's talk about the new magic number. According to the most recent joint guidelines from the American Heart Association, the American College of Cardiology, the target for most healthy adults over 65 is now officially less than 130/80th. If you raise sitting there with a reading of 135 or 138, you are technically in the stage 1 hypertension category. Now, I know what you were thinking: another pill, more side effects. But wait, because the reason for this change isn't just about your heart, it's about your mind. One of the biggest drivers of this shift is the long-term data coming out of the RINTMIND trials. These studies were specifically designed to look at what happens when we push blood pressure either lower than the traditional safe zones. For a long time, we knew that lower pressure reduced the risk of strokes and heart attacks. That is great, but the 2025 follow-up data gave us something even more compelling: cognitive protection. Researchers found that seniors who maintained a systolic pressure closer to 120, 120, had a significantly lower risk of developing mild cognitive impairment and even dementia. This is a game changer. We aren't just talking about preventing a heart attack, we are talking about preserving who you are, your memories, and your independence. But here's where it gets tricky, and where the truth requires a bit of nuance. While 130/80 is the general goal, it is not a one-size-fits-all law. This is the part where you have to be your own best advocate. There is a massive difference between a young 70-year-old who plays pickleball 3 times a week and a frail 85-year-old who struggles with balance. If we push that 85-year-old's blood pressure down to 115, we might successfully protect their heart. But if they stand up too fast, get dizzy, and break a hip, have we really helped them? This is the delicate balance doctors are now navigating in 2026. Second, we need to address the systolic obsession. For seniors, that top number, the systolic pressure, is the real MVP of your health report. As we get older, our diastolic, the bottom number, often stays the same or even drops. You might see a reading like 150/70th. This is called isolated systolic hypertension, and it is incredibly common in older adults. It happens because our large arteries, like the aorta, lose their elasticity. Think of it like a garden hose that has been left out in the sun. It gets stiff and doesn't expand well when the water pulses through. Because that hose won't stretch, the pressure inside spikes. That spike is what damages the tiny vessels in your brain and kidneys. The old school advice was often to ignore that top number if the bottom number was okay. We now know that is dangerous advice. The latest research confirms that the systolic pressure is the strongest predictor of cardiovascular events in people over 50th. If your top number is high, even if your bottom number is a perfect 75, your risk is elevated. We used to think that 100 plus your age was an okay systolic reading. If you were 70, 170 was fine. In 2026, we know that that's not just wrong, it's a recipe for a stroke. Third, let us talk about the white coat factor. This is a huge pain point for seniors. You go into the clinic, you've been sitting in traffic, you're worried about what the doctor will say, and suddenly your pressure is 160 over 95th. The doctor wants to start you onto different medications immediately, but then you go home, sit in your favorite chair, pet the dog, and your home monitor says 125 over 78. Which one is the truth? In 2026, the medical community is finally placing more value on out-of-office readings. The truth of your blood pressure is what it does during your normal life, not just the 3 minutes you waste sitting on a crinkly paper sheet in an exam room. Many of the latest guidelines now suggest that if your home readings are consistently lower than your office readings, you might not need as much medication as a single office visit would suggest. This is why keeping a log is the most powerful thing you can do for your health. If you're finding this breakdown useful so far, take a second to share this video on Facebook or the link to a family member. Most people are still living with 20-year-old information, and updating our knowledge is the first step toward better health. As we move forward in this video, we're going to dive into the specific risks of being too aggressive with your numbers, how to handle orthostatic hypotension, that's the dizzy feeling when you stand up, and the exact lifestyle tweaks that are moving the needle for seniors in 2026 without requiring a pharmacy's worth of pills. The goal isn't just to hit a number on the screen, it's to find the sweet spot where your heart is safe, your brain is sharp, and you feel great every single day. Finding that sweet spot is where the science of medicine meets the art of living. It is one thing to look at a chart in the book, but it is another thing entirely to manage blood pressure when you are managing a real life with grandkids, hobbies, and maybe a few other health conditions. In this second part of our deep dive, we're going to talk about why the best number might actually change as you move from your 60 seconds into your 80 seconds and 90 seconds. And I'll look at the red flags that mean your blood pressure might actually be getting too low. Fourth, we have to talk about the frail versus fit distinction. This is a massive topic in geriatric medicine right now in 2026. If you are a robust 70-year-old who is active and has no major issues with balance, the clinical goal remains that intensive target of under 130 systolic. The data shows that for you, the benefits of lower pressure, like preventing a heart attack or vascular dementia, far outweigh the risks. However, if you are 85 and dealing with frailty, meaning you've lost some muscle mass, you move a bit slower, or you have multiple chronic conditions, doctors are now taking a much more cautious approach. For this group, the truth is often that 135 to 145 is a perfectly acceptable and perhaps even safer range. The reason for this caution is a condition called orthostatic hypotension. You've probably felt it before that light, hadn't? Seeing stars feeling when you stand up too quickly from the couch or get out of bed in the middle of the night. As we age, the sensors in our neck that tell our heart to beat faster and our vessels to constrict when we stand up can get a little sluggish. If we use heavy meditation to force your blood pressure down to 120, we might be making it impossible for your body to compensate when you stand up. In 2026, the leading cause of injury-related hospitalizations for seniors is heart disease. It is false. A broken hip from a dizzy spell can be much more life-altering than a slightly elevated blood pressure reading. Fifth, Let us look at the diastolic floor. This is something many people and even some doctors overlook. Remember, the diastolic is that bottom number, the pressure in your arteries when your heart is resting between beats. This is actually the time when your heart muscle itself gets its blood supply. If your diastolic number drops to low, usually below 60 or 65, your heart might not be getting enough oxygen, even if that top number looks perfect at 125. This can lead to chest pain or even an increased risk of heart failure. So the truth for seniors is often a balancing act. We want that top number down, but we have to make sure we don't drag the bottom number into the basement. If you see your readings looking like 140/55, that is a specific pattern you need to discuss with your doctor because it requires a very careful touch with medication. Before we move on to how you can naturally manage these numbers, if you haven't already, please subscribe and click that notification bell. We are constantly monitoring the latest health trials so you don't have to spend your time scrolling through dense medical journals. We want to help you stay informed and in control of your health journey. 6. We need to address the medication burden. In 2026, the philosophy is shifting from more is better to the right amount for the right person. Many seniors are on 5, 7, or even 10 different medications. Sometimes a drug prescribed for something else, like an alpha blocker for prostate issues or certain antidepressants, can lower your blood pressure as a side effect. If your doctor then adds a blood pressure pill on top of that, your pressure can tank. This is why a medication review is so vital. The goal isn't just to add more pills, it is to look at the whole picture. Are your medications working against each other? Could a simple change in the time of day you take your pill make a difference? Taking your blood pressure medication at night, for example, has been shown in some studies to better protect the kidneys and reduce the risk of morning strokes. 7. Let us talk about the self-monitoring revolution. In the past, you relied on those once every 6 months checks at the clinic. In 2026, we have access to incredibly accurate home monitors and even wearable tech that can track trends over time. The truth isn't a single snapshot, it is the movie of your life. Doctors are now looking for variability. If your blood pressure is 120 one day and 160 the next, that swing is actually more dangerous than a steady 140th. High variability puts a lot of stress on the blood vessels. By tracking your numbers at home, ideally once in the morning and once in the evening, you provide your medical team with the data they need to see if your treatment is actually working or if your rage is having spikes triggered by stress or salt. One thing we've learned recently is that the way you measure at home matters more than we thought. Are you sitting with your back supported? Are your feet flat on the floor? Is your arm at heart level? If you are crossing your legs or talking while the machine is running, you can easily add 10 to 15 points to your reading. This leads to pseudo-hypertension, what people think they have high blood pressure, start taking meds they don't need, and then end up feeling fatigued and dizzy. As we head into the final part of this video, we were going to get practical. We talked about the numbers and the science. But now we need to talk about the how. How do you get into that 130/80 at that sweet spot without feeling like a patient? I'll cover the 2026 power foods that act like natural ACE inhibitors, the specific type of exercise that lowers pressure better than a treadmill, and the one thing you might be doing every morning that is secretly sabotaging your heart health. The truth is that you have more power over these numbers than a prescription bottle. While meditation is a literal lifesaver for many, it works best when it is supporting a lifestyle that keeps your arteries flexible and your heart strong. 8. Let us talk about the literal exercise revolution that has taken 2026 by storm. For years, we were told that if you wanted to lower your blood pressure, you needed to get out and walk, swim, or bike. And while aerobic exercise is still fantastic for your heart, the latest research has revealed a hidden shortcut that is even more effective for seniors. That is called isometric exercise. Unlike running, where your muscles are constantly moving, isometric exercises involve holding a specific position under tension. Think of a wall sit. You stand with your back against a wall and slide down until your knees are bent, almost like you are sitting in an invisible chair. You hold that for 2 minutes, rest and repeat. Landmark studies recently published in the British Journal of Sports Medicine found that these static holds actually lower blood pressure significantly more than traditional cardio. Why? Because when you hold that tension, your blood vessels are briefly squeezed. When you finally release and stand up, it triggers a massive flush of blood flow that signals your arteries to relax and dilate. It acts like a workout for the inside of your blood vessel walls. For a senior who might have stiff arteries, this is revolutionary because you can do it right in your living room without needing a treadmill or even a pair of running shoes. Ninth, we have to look at the natural aid CE inhibitors sitting right in your kitchen. In 2026, nutrition science has moved past just saying eat less salt. We now know that the ratio of potassium to sodium is actually more important than the salt itself. Think of sodium as the gas pedal for your blood pressure and potassium as the brake. Most Americans are flooring the gas and taking their foot off the brake by simply increasing your potassium intake through things like avocados, spinach, and even coconut water. You help your kidneys flush out that extra salt. Furthermore, we're seeing incredible data on specific foods that act like natural versions of blood pressure medication. For example, hibiscus tea has been shown in clinical trials to be nearly as effective as some low-dose diuretics when consumed regularly. Then there's the celery seed and olive leaf extracts that are becoming mainstream in 2026. These contain compounds that naturally block calcium channels or inhibit the AC enzyme, the exact same pathways that popular medications like Wiz and Obler target. I am not saying you should throw away your pills for a cup of tea, but by adding these power foods, you might find that your doctor can actually lower your dosage over time because your body is doing more of the heavy lifting naturally. 10th, we need to address the morning spikes that sabotage so many seniors. Your blood pressure isn't a flat line that follows a circadian rhythm. For most people, it is lowest at night and then surges right as you wake up to give you the energy to start your day. However, if you have hypertension, that surge can be dangerous. In 2026, we're learning that the first hour of your day is the most critical. If the first thing you do is reach for your phone to check the news or your emails, you are flooding your system with cortisol and adrenaline. This stress hit on top of your natural morning surge can send your numbers through the roof. The truth for 2026 is that a low-pressure morning is a choice. Start with 5 minutes of deep, diaphragmatic breathing before you even get out of bed. This simple act tells your nervous system to switch from fight or flight to rest and digest, which naturally lowers the pressure in your pipes. And if you're a coffee lover, be mindful. While coffee has health benefits, that caffeine hit right during your morning surge can cause a temporary 10-point spike. Try waiting until you've been awake for an hour or two, or better yet, enjoy a high-potassium breakfast like a banana or Greek yogurt first to buffer the effects. As we bring all of this together, I want to emphasize one final, crucial point. The best blood pressure for you is the one that allows you to live the life you want. If the push for 120/80 makes you so tired you can't play with your grandkids, or so dizzy that you are afraid to go for a walk, then that's not the right number for you. The truth is that medical guidelines are just a map, but you are the one driving the car. In 2026, the gold standard is no longer a single number. It is a shared decision-making process. You take your home logs into your doctor. You discuss how you feel on your medication, and together you find that sweet spot, usually somewhere between 125 and 135 for most healthy seniors, and maybe a little higher for those who are more fragile. Before you go, if you've made it this far, it shows you are serious about your health. Please subscribe so you don't miss our upcoming deep dive into the best foods to unclog arteries in 2026. And remember, every bit of progress counts. You don't have to change your entire life overnight. Just pick one thing, maybe the wall sits or the morning breathing, and start there. So here is your next step. Go grab a notebook, and for the next 3 days, take your blood pressure twice a day, once in the morning and once before bed. Bring that log to your next appointment and ask your doctor, based on these numbers and how I am feeling, what is the safest target for me specifically? That conversation is the real key to longevity.